All right, well, lovely to be here. Thanks for having me. And yeah, it's really tricky because there's loads of things that I'd love to talk about. But I think when I was chatting with Leah beforehand, I thought, actually, do you know what? Let me just focus on bisexuality and specifically non-suicidal self-injury, which is what I've done most of my kind of research stuff in. But then I thought, well, let's give a little bit of a nod as well to some of the broader queer mental health stuff that I talk about maybe when I do other lectures on this. And then, yeah, talk about what's coming next for our kind of little research group that we've kind of got going on at the university. So you folks, you kind of know what the topic of this particular webinar is, of course. Just take care of yourself. I'm acutely aware, as I'm sure many people are, the world is a pretty crappy place to be living in at the moment if you are LGBTQ+. So yeah, I mean, my thoughts are with everyone that might be struggling a little bit at the moment, especially with the focus on Qatar and also the really horrific terrorist attack that happened just a few days ago. So I know that this can be a really tricky thing for us to hold in mind. So very mindful of that. Okay, so as Hazel kind of said, this is going to necessarily have to be a bit of a whistle-stop tour because we could deep dive so many things here. But what I'm doing is kind of zooming out just a little bit and giving you a little bit of a broad overview, and then just diving into a little bit of the kind of bisexual specific stuff. And yeah, maybe in the conversations that we have following this, or absolutely via email afterwards, I'm happy to talk with people about broader stuff as well. So it might come as no surprise. We know that LGBTQ+ people have higher rates of mental health challenges. And we also know that the specific rates of non-suicidal self-injury alongside other forms of self-harm or self-harmful behaviours are elevated within these groups. And the work that I was doing as part of my kind of doctoral thesis work was, as I've said, zooming in on bisexual people and looking at self-injury for this particular group. So as part of that, a meta-analysis that I did found that basically, yeah, bisexual people have much higher odds of engaging in non-suicidal self-injury when compared to heterosexual straight people, but also other gay and lesbian people as well. So there's something about bi people that we know is unique when it comes to this particular behavior. So, you know, thinking a little bit about what this might be, I'm going to talk a little bit about this when I kind of come onto this shortly, but holding in mind certainly difficulties with biphobia, heterosexism and relationships. This was found in our meta-analysis, and also a narrative synthesis of some of those other variables, which we couldn't necessarily include in the meta-analysis. These types of things were flagging as being related to NSSI in the literature that's already published. And I was doing my thesis, you know, when COVID happened as well. So we were also kind of thinking as a little bit of a research team, what's COVID doing to bisexual people? Because we know the literature is telling us about some of these unique challenges that other gay and lesbian people might not face. So it might be helpful for us to look into that. So we did go for an ethical amendment to interview people during the COVID lockdown as well. So zooming out a little bit just about kind of situating, I guess, bisexual people within the world, and a little bit of a focus on queer mental health in general. When I talk about this topic, I like to kind of draw people's attention to the fact that, you know, LGBTQ+ people, queer people live within structures and systems around us. You know, none of us live remotely by ourselves. There are multiple systems that are always at play. So those of you that might be familiar with Bronfenbrenner's ecological systems theory, you'll recognize these circles as being similar to the kind of exosystem, mesosystem, and things like that that Bronfenbrenner talked about. This is, it's using those principles, but just applying them to different ideas and different systems. So yeah, I talk with people quite a lot about kind of the people and groups that are around the queer person. But then also, you know, wider than that, also the systems, the structures, the institutions that wrap around these people, and also the social stories and the discourses and the narratives that follow on. And the idea is that these wider ideas of social discourse, institutional policy, laws of the country you're living in, trickle down and of course have an effect on the people and groups around us. You know, it kind of gets into people's psyche. It's because it's so baked into the social fabric. And of course, the way in which people around us interact with us and also with queer people will have an effect on that person's mental health and well-being. So there's just an example on the right of how some of these wider variables could very tangibly trickle down and have an impact on the thoughts, the feelings, the behaviors that queer people could present with actually in the therapy room. So I talk a lot with people about mental health intervention, and this is not going to be a surprise to lots of you on this call. Mental health intervention cannot be purely individual. It can never be purely individual because, you know, I think that's just not helpful for people to kind of give them these tips, tricks and skills, and then to potentially send them back into environments or systems that are actively harmful. You know, I think as mental health practitioners, we need to be focusing our intervention and our influence at broader levels, as well as supporting people individually. So again, when I give a lecture which is a bit broader than this, I try and bring people's attention to these systems of oppression that can operate in and around us. These things include things like the patriarchy, patriarchal influence, ableism, white supremacy, socioeconomic division, lots of things that exist to keep certain slices of our communities oppressed and hidden, but that which is not always really easy to name. It's not always really easy to grasp these things because it's sometimes like grabbing water. You know, it's a bit amorphous, but it's really important that we think about and name these systems because this holds up and perpetuates a lot of psychological and also physical violence towards queer people. So moving back slightly, that's the kind of frame that, and this is the way that I view the world and the way that I view research as well. And of course, when thinking about self-harm, non-suicidal self-injury, self-injurious behaviors in other forms, and also suicide, those things, those circles of influence, those systems of oppression, I think are really, really important for us to hold in mind. So the research that I've been involved with at Manchester, specifically so far, has, as I've said, focused on bisexuality and non-suicidal self-injury. So there is at the top, our meta-analysis that found that, yeah, bi people had up to 6 times the risk of this behavior when compared to heterosexual people, and still 4.5 times the risk compared to gay and lesbian people. And this was looking at studies that had recorded NSSI over someone's lifetime, but also from the past 12 months. So we were looking at lots of different meta-analyses, comparing with lots of different people. And then, yes, in terms of other variables from a bit more of a kind of narrative synthesis perspective, we found that mental health experiences of anxiety and depression were associated with NSSI for these people, but also some of those more interpersonal variables like bullying or abuse. So my kind of main empirical study, if you like, was an online micro longitudinal study, which basically means that it took place over 6 weeks. So it wasn't longitudinal in the sense that it took place over months or years, but it also wasn't cross-sectional. So it didn't take place over a week or two. So it was kind of micro longitudinal. And I was looking specifically at 2 variables, which is something called thwarted belongingness which some people might recognize as being a variable that is associated with the interpersonal theory of suicide, and also self-esteem, because the literature was kind of telling us about this disconnect and about this kind of lack of self-worth. So we were thinking, this is a really interesting things that we need to be looking at. And then my colleague, who I did the study with, Sophie was looking at biphobia and also rumination. So when those thoughts run around our head, and with these 4 variables, we wanted to see whether they had any relationship with self-injury, non-suicidal self-injury for bi people, both over time. So, you know, as the weeks went by, but also at the same point in time. So at certain slices of time, did they have a similar relationship or an associated relationship? So we found, well, certainly for this one, Sophie's paper is currently being prepared for publication. So that'll tell us about the biphobia and the rumination. But for thwarted belongingness and self-esteem, both of these variables were significantly associated with self-injurious urges, but also behavior, because we were looking at both of these facets. And we also found that actually self-esteem could predict a relationship between self-injury and someone's bisexuality when we looked at people separately. But actually, so that basically there was something about you know, over time between people, for some, self-esteem was related, but for others, maybe not so much. But with the second part of this model that we looked at, thwarted belongingness, so this idea of kind of not necessarily being connected anymore, or not feeling connected anymore, was significant within the same person. So for the same individual, over time, if their feeling of belonging decreased, then their urges to hurt themselves increased. So that's what we kind of mean between persons, between different people, and then within the same person. We, as I've mentioned, we did a little bit of a spin-off study, which was qualitative. So that one was quantitative, looking at numbers. This one's qualitative, looking at experience. So we interviewed 15 young bi people from that study. And that study that I just mentioned before had 207 people taking part online, which I think is pretty fab actually for a sample of bisexual people. And they took place from, I think, like 25 different countries. So we were able to kind of look at what different countries were doing as well. But sometimes there were such small numbers, we couldn't really tell much about it. But 15 people from the UK took part in this qualitative study, and we found that from their narratives and what they were telling us, we constructed 4 themes, which was coping with this heteronormative and binary focused world. So the idea of heteronormativity, you know, this idea that being straight is the default, is the correct way of being, and also this very binary, you know, kind of this or that, gay or straight, man or woman, very binary focused experience was important for our participants. They spoke about their relationship between bisexuality and self-injury. For some people, it was directly related. For some people, it was a bit more distally related, a bit more, you know, kind of contributes to a much bigger pie, so to speak, but it's not the whole meat. People talked about their experience of lockdown, which was mixed. Some people really enjoyed lockdown because they thought, actually, I was able to lock down somewhere else where I didn't have to be around biphobic and, you know, abusive people. And some people spoke about the experience of lockdown being really, really tricky and really traumatic because they didn't have their support networks of other bi or queer people that they could hang around with. And then, yeah, we also asked people a little bit about self-injury, and we were able to construct, you know, a theme about the meaning and consequences of NSSI for these people. For some people, the meaning associated with this and the consequences of this was positive. It was helpful for them in some ways. For others, it wasn't so. Very recently, a master's student that I supervised, Malia, has looked at bisexual women's experiences of psychological therapy. Slightly smaller sample this time, 8 people. Again, 4 themes were constructed. Malia found that people were talking about managing intersecting identities. So actually this junction of being bisexual, being a woman, and potentially inhabiting some other kind of minoritized identity as well. People spoke about anticipating biphobia, and actually this idea of biphobia was expected. So come on, where's it going to happen? So this kind of baseline of expectation of that prejudice. Participants spoke about psychological therapy as being sometimes really helpful for them and sometimes really harmful for them, because they had to maybe educate their therapist about bisexuality, or linked again to what Hazel was saying, sometimes people's difficulties for these participants was framed as a consequence or a kind of adjunct to their sexuality, with the insinuation that, you know, maybe it's because you're bisexual that this is happening, which of course is a really unhelpful way to be framing things for people. And then finally, participants also spoke a little bit about how their suggestions for improving therapy, which included ideas like the therapist should maybe, you know, be comfortable asking about this from the off, rather than it bubbling underground and not really being spoken about. And also some participants spoke about the value of sharing of lived experiences. And actually, if they knew that their therapist was from the LGBTQ plus community, or even just some other kind of minoritized community, and they embraced that, participants felt a bit safer, and they recommended that other therapists should think about that. So what's going on with this? Epistemic injustice is something that I flashed up on the system of oppression slide earlier. Epistemic injustice is something that is this idea that people that have knowledge, and some people on this call might be very familiar with this theory, some people that have knowledge, when they are wronged or silenced in their capacity as that knowledge owner and knowledge giver, that's what Fricker describes as epistemic injustice. It's this idea that you're not bisexual. You're not. You're just coming out as gay. You're on a journey. You know, you're undecided. When people hear that, it's this idea of, hang on a minute, I'm the one that's got the knowledge and experience of this. You're telling me it's wrong. So that's what Fricker describes as epistemic injustice. I'm being silenced in my capacity as the knower. And also minority stress. Some folks might be familiar with minority stress theory. It's a really kind of pivotal theory that's been expanded upon over the years. This idea that external and kind of then internal stresses can then confer risk for mental health challenges. So a couple of important theories that were spoken about in these papers. Multiple systems of oppression operating for bi people. Yes, there's the homo, bi, and transphobia stuff. There's also patriarchal stuff. We know that bisexual women have got to navigate sexuality and a gendered world of patriarchal oppression. And again, if you are a Black bi person and you're also neurodivergent and deaf, there are multiple barriers that you have that, when combined together under this intersectionality idea that Kimberly Crenshaw talks a lot about, that creates a lot of shit for people, which they have to manage. And that can compound mental health challenges. And of course, what we know about self-injury could be selected as a way of managing that emotional distress. Circles of influence for bisexual people likely to be linked to these multiple systems of oppression. Mental health services need to be aware of this link. You know, we know that non-suicidal self-injury is something which is statistically more likely to happen within bisexual people. And we know that there are elements of not belonging, feeling disconnected, not feeling like you're worth anything, that are connected as well to this behavior. So as a clinician, if I'm working with a person and I know that they're bisexual, and I know that they're telling me about and not thinking of themselves very highly and feeling like people don't listen to them, I will then almost cue myself to think, I need to ask this person about hurting themselves, but I need to do this in a really compassionate way, because I know that that could be going on for this person, or they could be thinking about it. So what's next? I've got a trainee that I'm supervising that's getting ethical approval to do a small group intervention, a small group therapy intervention for young bisexual people that have these self-injury urges. And guess what? We're focusing on self-esteem, because we know that self-esteem is associated from the study that I did. So we're going to say, actually, we're going to try and target self-esteem and see if that works. And if it does, this could then lead on to potentially a much bigger project where we could be looking at a self-esteem intervention versus a control or a comparator group to see whether actually that's what we need to be doing a bit more of. Another psychologist that I'm supervising is going to be looking at bisexuality and self-harmful behaviors as an umbrella. You know, I'm sure we could get into a debate about what falls under the self-harm umbrella here or elsewhere, but I'm particularly interested as well in some of the kind of non-traditional, in inverted commas, forms of self-harm, such as restricted eating and eating disordered behavior, if that has a self-punishing function. Sex as a form of self-harm. This is something that's been researched quite a lot in the Scandinavian countries, but also self-neglect and some of these other kind of self-harmful behaviors that we don't always capture on our traditional measures. I'm supervising a psychologist in Leeds that is looking at how bisexual men construct their understanding of mental health, their gender and their sexuality, because again, bisexual men are a group which again face multiple challenges, just like bisexual women. So we need to understand how bi men construct their identity and how do they talk about it and communicate it, because that'll give us an insight potentially into what we need to know as therapists and psychologists. Finally, something, and you know, when I sent these slides across, I have added a couple of little things in because there's been a few things that have happened since I sent these slides across. There is a framework that myself and my colleague James Lee have just published, and this is a kind of intersectional social and systems-based framework which we've put out there. It's based on the Queer Mental Health Workbook. It's based on the book that I've done, but when I was giving this talk, when I was talking with people about this, people were saying, yeah, but what's the clinical application? You know, you talk to us about these things, but how do we put it into practice? So this is a kind of bit of a narrative paper that says, here are some of the questions that you could ask people. Here are some of the things you can think about that might help you have these conversations. So this can be applicable to bisexual people, but it can be applicable to a whole bunch of people from the LGBTQ+ community. And it can be used with other marginalized groups. This can be used with, you know, people of color, you know, Black and brown people. This can be used with disabled people, neurodivergent people. This can be used with a whole bunch of marginalized folk. So if anyone does check that out and has any feedback on it, let me know. I'm very interested in hearing feedback, you know, the good, the bad and the ugly, because James and I could try and refine this. That's the book, you know, I know Leah mentioned it earlier, that's the book that was thrown out into the world earlier this year. So again, this book was created because I was working with a lot of young queer people that the therapy I was using wasn't quite fitting, and I was thinking, I was adapting lots of stuff and I was kind of drawing my own little things with people. And then a few people were saying to me, actually, that's really helpful. Can we have a look at that as well? So then this idea was germinated that actually, why don't we try and put this out there? So that's the book. And then there are a bunch of resources there are a bunch of references here based on what I have spoken about today. So I'm sure these slides can be sent round and will be sent round to people, but that is everything from me. So I will stop sharing, and then if anyone has any questions or anything like that, I'll be more than happy to answer them or try to answer them.